All right, welcome everyone. SeeBeyond seminar number 4. We'll be talking about psychedelic medicine with a focus on ketamine and these new therapies with tremendous
No, it's okay.
potential for health and healing. The
Yeah,
SeeBeyond
I'll take some
seminar,
notes. Sure.
this is our
Yes,
fourth
thank you.
and really meant to be a bridge between what we do on the front lines every day and you, our
Have a
patients,
great day.
that
Thank
may
you.
want to
Have a good
attend
one.
to
Thanks
really
so
try to
much.
share what we're learning and so that you as patients are more informed of some of these things that are moving quickly in the modern medical world. This is the second time I have the tremendous pleasure to present with one of our close colleagues. And with me today is Stacy Bloom-Frankel, a ketamine-assisted psychotherapist. Welcome, Stacy.
Thanks for having me.
So excited to have Stacy with just a wealth of experience in the world of ketamine and ketamine psychotherapy. And with that, we're going to kind of jump right in. Usual disclaimer, as we always have to do with any type of live or educational content, this does not constitute a doctor or provider-patient relationship. You should speak with your own physician, and even if I am your doctor or Stacy is your therapist, that should be done separate from this educational content. We can read the rest, but just remember this is educational purposes only. And so front and center, I sometimes wish this was a classroom. I could ask the crowd, I guess I could maybe do it in Zoom or in Instagram, how many of us have heard of ketamine? And I would assume most of us are raising our hands because it's something that's certainly in the public attention. We're learning a lot more about. It is an FDA-approved dissociative anesthetic. And so even as a physician in medical school, learned about ketamine and even on rotations, utilized ketamine. Mainly for anesthesia. And the flip side of that is I learned about it mainly as a drug of abuse. And so really were these two sides of the coin for this long-standing medicine. To be technical, it's not a traditional psychedelic medicine that we usually define as acting on the 5-HT2A receptor, being a receptor agonist. But when utilized at specific dosages, some liken it to, a hallucinogenic or psychedelic state, and it does induce a dreamlike state and has a proven antidepressant effect, which we'll be talking more about. Similar to many substances, right, that are coming online today, and many of you are aware that I have a pretty lengthy history in cannabis. They're FDA approved for very specific treatments, and really anesthesia is the only FDA approved treatment for ketamine and not for any psychiatric disorder. Within medicine, which we don't talk much about, and I was really enlightened when I did research about the number of times that we use a drug off-label, which means that it's gone through a long and lengthy FDA process for a very specific condition. But oftentimes as physicians, we will utilize it for other conditions not specific to that FDA approval, but where we either see evidence or have worked with patients and have seen, even anecdotally, it's worked in the past. The one form of ketamine that is FDA approved is the S form of ketamine and has a brand name, Spravato, that's a Schedule III controlled substance, and it was approved in 2019 as a nasal spray for treatment-resistant depression in adults. And depressive disorder with suicidal ideation, and in conjunction with an oral antidepressant. So there is precedent for the nasal spray formulation of S-ketamine from an FDA perspective. And that being said, there are many indications, and we'll talk more about these, where ketamine is being used off-label. I'll be frank, in my role as a physician, I've seen it most utilized in the realm of chronic pain, but other potential conditions that respond to this, right? And we'll hear more from Stacy, who's on the front line working with us, include depression, anxiety, PTSD, suicidal ideation, obsessive compulsive disorder, substance abuse, and neuropathic pain. There is, a number of conditions that potentially ketamine could be a very useful tool. And we'll talk more about that as we get into it. For me, there are a lot of patients and sometimes even physicians will ask, oh, well, you're not a psychiatrist. Why are you talking about mental health? I think we do forget that really the front line of mental health care are primary care physicians. And, the majority of even SSRIs, antidepressants, are prescribed for better or for worse, whether you agree with that or not, by primary care physicians. And so I have been frontline of kind of mental health care in my career throughout the duration of my career. And there are estimates in family medicine, upwards of 60% of what we see has some relationship to mental health. And I'll be frank, there haven't been great tools. There's been a lot of debate that I follow closely, even in the realm of SSRIs, oftentimes our go-to pharmaceutical treatment, and really evidence showcasing a good percentage of patients don't respond to the treatments that exist. Another challenge with a lot of the treatments that are right now is this duration or this time that it takes for a pharmaceutical to take effect. If I have a patient with severe depression and I start them on an antidepressant, oftentimes an SSRI, estimates are upwards of 4 weeks for full effect, sometimes even longer, as you see from the slide. Also, the number of side effects associated with the medications, and just there really hasn't been new therapies in, what I would argue, one of the greatest epidemics we're facing right now, and that is mental health. And so just a couple, sentences here on, well, what makes ketamine different from the SSRIs, and just put a couple names on here for those that may not be familiar with SSRIs: Prozac, Celexa, Lexapro, Zoloft, Paxil. One of the major differences is the route of administration, right? And so ketamine can be given through the vein, right, through an IV therapy, through an injection in the muscle, right, through the nasal cavity, right, which is the FDA-approved medication that we talked about, or even orally. It is administered in a doctor's office, and the effects last about 40 minutes. The dissociative effects last for about 40 minutes. But one other big thing that really is a marked difference is how quickly it begins to have effect. Right, and I've seen estimates as quickly as 15 to 25 minutes that this medicine could have an impact on some of the conditions we're looking to treat. Very different from something that might take 4 weeks to kind of kick in. And again, then mechanism of action, and this is a very kind of complex and complicated sentence to kind of distill down ketamine working via the glutamate pathway, but it is very different from the majority of agents that we're using, which are usually serotonin, norepinephrine. And again, speaking to novel agents in the realm of mental health, it is interesting and sometimes exciting as a physician to see different pathways being explored. Mental health is incredibly complex, right? Like the majority of things that we treat, and one of the things I'm in favor of are parallel pathways, right? Parallel mechanisms of action. And I put this slide on here just to distill down. It's an oversimplification, but just for those that don't study neuroscience or aren't real in depth into ketamine and mechanisms of action, glutamate and GABA are what we might call the yin and yang, right, of the central nervous system. Glutamate being an excitatory neurotransmitter. Many of the patients here at SeeBeyond are aware of GABA, right, which we talk about a fair amount as a calming neurotransmitter. We see a few of what we can expect, right, on the human side from these differing receptor systems. It is an oversimplification, but one of the big things that ketamine does is it allows for glutamate release to happen in pulses in very specific circuits that can help with depression, with chronic pain, with other things as we'll get into, without just an overload of glutamate, which can have a negative impact, right, on the brain overall. And this is, I think one of the areas that first opened my eyes and I got really excited about with the idea of, not only ketamine, but psychedelics in general. And this is this idea of neuroplasticity. And in medical school, a fantastic training I had, but even at the time, the thought was there is no such thing as neuroplasticity. We're kind of, for better or for worse, condemned to the brain cells that we have and the connections that have been made, and those don't change over time. This has been, I would say, an absolute revolution in thought that through therapies, not only ketamine, but the psychedelics and otherwise, we're seeing that there is an inherent neuroplasticity that goes on throughout life. We're not condemned to specific brain circuits or even what I would say very specific patterns of thought that we'll talk about before, but we do have this ability to grow new circuits, to grow new synapses, and to change our ways of thinking. And ketamine specifically overcomes that intrinsic resistance to the recovery of the brain and restores that capacity to develop and maintain these connections that occur within the brain, which is a very exciting and kind of new approach to mental health and health in general. With that, Stacey, I'll turn over to you to speak to the patterns.
So I really appreciate hearing the neuroscience and all the medical information of how the brain works. The way I usually explain it to clients that I'm working with, and definitely more layman's terms, is just about the patterns that get set from our infancy, childhood, adolescence, adulthood. We have certain thoughts, emotions, behaviors, and it's hard to change them because they get grooved into those grooves in our brain. They deepen the grooves over time. So when they're repeated over and over again, this is what makes it so hard to change. So I like to explain ketamine as a fresh powder snow type of treatment. So it kind of flows into those grooves in the brain, and all of a sudden it's a lot easier to make new tracks. So new thoughts, new emotions, new behaviors, it's easier to shift into that change.
I think I think about this a lot, and I get really excited about it because we're focusing a little bit more on mental health or even chronic pain. And I think about a lot of what I see is we do get in the technical term, oftentimes I see in psychedelic research is this default mode network.
Mm-hmm.
And I've even shared with patients sometimes estimates, and I've seen different numbers, but 95% of our thoughts are the same ones we had yesterday, right? And so we get in these kind of thought process and patterns that don't change over time. And I think many of us have either experienced or witnessed a loved one or worked in the medical setting of someone that's in what we might call a funk,
Mm-hmm.
right? A negative thought pattern. And we have many mechanisms to try to change that. But one of the things is I've seen, and I do sometimes even liken it to things like weight loss, right? We get in patterns of eating, we get in patterns of lifestyle that make it very difficult to change. And I find the same thing happens in mental health, that we need tools. We need additional tools to get out of that. I sometimes say groove in a record, or, like we're talking about, we need that fresh powdered snow to incentivize us and to help move us over the hump to create new changes in our lifestyle even, right? Which is really what it is. And we say a lot of times in integrative medicine, if you're going to keep doing the exact same things that brought us to the table, right? And oftentimes coming to my table with a disease or a symptom or an issue, we can't expect different outcomes. Mm-hmm. And I love this thought of utilizing a tool like ketamine or psychedelics to change that groove so that even our lives change in many ways.
So the typical course of treatment for ketamine infusions is 4 to 6 weeks and 6 different infusions. I like to meet with clients at least twice before they start the medicine, just to help get to know them, educate them, go over any questions, calm any of their fears. And then after their infusion treatments, so that they can talk about the journey, and we go through integration sessions.
Yeah, I think this was an area where Stacey and I really first saw eye to eye. Again, and where I was first impacted by this was a lot of work that I did across the world in cultures where psychedelics are a part of that culture. Never once did I see someone come to a medicine healer, a shaman, and here's your medicine and I'll see you later. There's always a preparation, there's an anticipation, there's an engagement prior to, there is the actual process of ingestion, of receiving the medicine, and then there has to be this integration. And I just really believe that to be true with these substances that we're discussing right now. And I know that you and I see eye to eye on this, that I think this is a key slide for anyone looking to explore. In some way, we should be, incorporating these into your ketamine and future psychedelic therapy if you explore that path.
So as Dr. Dahmer started to talk about the preparation, it is an important piece of learning how the medicine works, understanding it, so that you kind of develop this relationship to ketamine as though it's your ally, to know that you're going to have a positive experience, even though challenging material may come up. You can continue to take prescribed medications while you are using ketamine infusions. So that's a key point. But you should detox from alcohol, THC a couple of days before, just so that the ketamine can be as most effective as possible. Make sure you're properly rested and hydrated, and comfort is key. Wear comfortable clothes and just get into a good positive mindset.
Yeah, and maybe I'll go off script here a little bit. In my experience with psychedelics, what everyone would be worried about would be a bad trip, right? And that's where I think this part is so invaluable. One is to be careful not to plant a negative seed, right? But I do believe that fear is a part of this process, and just the fear of the unknown, and to be able to freely speak to that, to potentially offer some tools, like if fear rears its head, and it very well could, right? If our heart starts to race and our mind starts to go in a direction maybe we're not super excited, here's a tool that can bring you back. And also here's a comfortable, familiar voice that can help pull you back on a path, right, where it might not lead that direction of a bad trip. Any thoughts on that?
I like to say that challenging material can definitely come up, but your subconscious is not going to show you anything you're not ready to handle. And that's what the preparation sessions, the biopsychosocial assessment, and our getting to know each other sessions prior to starting the treatment, we're going to have a sense of potential issues that might come up, and have some tools in place on the self-talk to keep calm and to allow the material to be there and to be curious about it, to embrace it as something that you're going to learn from, that can't hurt you. You're in a safe place. And yeah, just kind of reminding people of their inner healer and what it's ready to show them.
I don't want to steal your future slide, right?
Well, a big piece of the meeting and before the ketamine infusion starts is setting intentions. So during my appointments and sessions prior to the medicine, figuring out why they're there, what their goals are. I'm a big believer in journaling, getting out some ruminating thoughts and onto the paper and out of your head, and exploring them in deeper ways, just so that we can understand and have a sense of what may be coming up. Intentions work best when they're specific and focused and personal. And then some key tips about setting intentions are closing your eyes so that you can really feel it as opposed to just thinking it. And yeah, writing it down. So the idea is that you're prepared, that you want to utilize this medicine in a specific way to reach your goals. However, once you get into the chair and start the infusion, then you want to just let go. So you may have an idea of where this journey and this trip is going, but your inner healer and your subconscious may take you in a different direction. And that's okay. Just relax, let go, let it flow, trust the process. This slide shows some images of what that comfortable chair might look like. You get an eye mask, you're listening to a curated playlist on a headset. You're being monitored by doctors, in a medically supervised setting throughout the entire treatment. So again, just a reminder that you're in a safe place and that this is a safe container to have this type of experience.
What are, I don't think we have slides covering this, but, again, I think we've talked about before, and many of my patients know I'm a big fan of letting go and how powerful that can be in a healing process.
Yes.
What are some of the other things that you've kind of heard during this part of the therapy that, that patients have shared in this aspect of the journey, where you are kind of relaxing, letting go and let it flow, that coming out on the other side, that revealed to them?
This can be a challenging part. The medicine, at certain dosages can be powerful and overtake you to let go. But when people are having trouble with that piece, we encourage them to connect with the breath and focus on the music, because the music will be that kind of soothing tool that helps you just kind of transcend.
Yeah, I've seen some research that again, not 110%, but the intensity of the experience can be proportional to the therapeutic response. And I know that's still debated a little bit, but so that if you are able to allow for that intense experience and still be in a good space with it, that may improve outcomes on the other side. I know that's a little bit debatable, but the other things in some of the research I've done, and we'll talk a little bit more about that too, is this, kind of what's called ego dissolution. And I know I'm taking it to that next level, but this kind of connection to something greater than ourselves, right? To take ourselves out of that groove in the head of it is just me and my pain, or just me and my sadness, of this connection that you actually feel of something greater than yourself. And we have 7 pillars here at SeeBeyond Medicine, that the 7th is spirituality, which can be a touchy subject, right? Oh, I'm not religious, or I am very religious, and great for both of those. I define it oftentimes as this connection to something greater than ourselves. And to think that there is a therapy that actually taps into that, I think it can be very powerful, right?
People have referenced peeling the layers of their being so that they feel like they got to a core part of soul.
Right.
And so that definitely has been more the vivid, strong, impactful experiences people have described. People have also talked about it being like the best massage in the world, just the most relaxing thing. But yeah, the concept of spirituality, for people that are resistant to that, we also offer the idea of hope. Just can you be hopeful about something, as opposed to, believing in God, if that's something people are resistant to.
Yeah, it's a question I've long asked patients, like even since the beginning of my career. Do you have any hope that things can get better?
Right.
When there's a hard no, that's a challenging one, right?
Yes.
And finding ways to go about that. But let's talk a little bit about that, peeling the onions away. And I find too, the ego falls down, and there is something there, right?
Absolutely. So your inner healer, I say that this is the healthy, positive part of yourself that's seeking treatment. We all have an inner healer within, and it's that positive, good voice that I'm just thinking of myself as a guide to help turn the volume up on that positive, healthy part of the client who is ready to embrace this healing journey.
Yeah, and this is like, in my seat, such a challenging topic. How many times have you heard your doctor talk about your inner healer, right? It's calling out the elephant in the room a little bit. I will say that, again, in my experience, integrative medicine, this is a basic tenet of the innate ability of the body to heal itself. And again, those with severe disease will fight back. There is always some kernel of healing that's potential, right? And that's, to discover that and to try to amplify that, I think is very powerful. And that's really what I've been trying to do in my integrative medicine career forever. And again, to find tools that allow for that to happen is really remarkable.
I thought this was a humorous way to reference an inner healer. This little dog giving a TED talk. What if I told you the things you've been chasing your whole life have been a part of you all along, with the big image of his tail? Just that, yeah, the inner healer, it's a part of all of us, no matter how in touch with it you actually are.
I like this slide a lot, because in my own experience, I really try to empower a patient and make shared decision making, right? And I have had difficult moments with a patient that says, you're the doctor, tell me what should be done here. And I just have really found that if you can engage that inner healer, and it's not just me doing stuff to you, right? And I believe that sometimes in modern medicine, we're doing all these things to you, and at times that's required. But when it becomes a participatory, right? And there is an inner healer that you might believe in, that's really a relationship that flourishes. And yeah, I can do all kinds of stuff to you, but to have that buy-in, that's the magic.
How's your day going, man?
Is the secret sauce. That there is something in each and every one of the patients that's in front of me that
we're
trying to bring out, in addition to what we're doing to them.
Absolutely.
You're the best.
Self-empowerment, I think, is a big part.
Control. Right?
Yeah, just knowing that they are an active participant in this healing journey. And this is another favorite slide and quote from a childhood movie, The Wizard of Oz, the Glinda, the Good Witch. You've always had the power, my dear. You just had to learn it for yourself. So a lot of times clients will reference things that they intellectualize, like they know that they need to practice forgiveness or let go of a past hurt, or they have the intellectual ideas of how this is all happening. Bring it to a whole nother level in like a visceral way that they can feel.
Yeah. No, I think there's a lot of talk about this too, is that, really we are a lot of like kind of thought based and really mental processes as opposed to, kind of somatic, which is a real healing part of the journey. And to be able to access that, I think makes a lot of sense.
I also like to explain to clients that the medicine works in three different ways. So the biological, all the brain chemistry information that Dr. Dahmer explained about glutamate and neuroplasticity, that there is something happening on a biological level. Experiential is what's happening in the chair, those 40 minutes while you're actually getting the treatment. And that's where people get worried about, oh, what if I have a bad trip? So, or if sometimes they'll say, it just felt relaxing, like the medicine isn't working. So these are times where we'll explain, no, the medicine is actually working because there are these other ways the medicine works. So maybe you had a relaxing trip because that's exactly what you needed.
Yeah.
A lot of people who are on the go and maybe a little bit more type A, they love having this relaxation experience with the ketamine infusions. But the idea that the experiential part in the chair is just one little piece of the 40 minutes of how this medicine works. And then the third way is the adaptive integration talk therapy, and taking those insights and how do you use them to your benefit to make changes in your daily life.
Yeah, and that's I realize that this is kind of contradictory to what I said before. Like the intensity of the experience can relate to the therapeutic effect. And I think one of the things that we're really seeing in medicine too, and I like about this approach, is that what a textbook says, and we need guidance on dosing, we need guidance on safety, but that doesn't necessarily apply to that patient in front of me. And I've had a lot of experiences with patients and read a lot about too, a very low dose having profound effects, and you can't predict that from the outset. And so maybe we'll take back that other statement of you have to have a profound effect for therapy. Again, one study might show that it's like what fits the patient right in that moment, and it doesn't necessarily mean it has to be a whopping dose or an out-of-body experience. That there is a therapy that's occurring even at low doses that might not be so perceptible.
And I've had clients who have only done 2 or 3 infusions, felt that the experience was impactful, powerful, and there was enough material for us to work with in therapy. They were feeling better, and it didn't feel necessary to go on for more infusions. So that was fine too.
Yeah, good.
This is again speaking to the 3 different ways the medicine works. The experiential in the chair, so that is the 50 minutes in the doctor's office. The biological effects that can continue for 2, 3, 4 days. And then the adaptive part of therapy and meeting regularly to just kind of deepen those positive grooves. So you started to talk about ego dissolution, the experience in the chair. There's different ways people describe awe. So whether that's ego dissolution, perception of vastness. So that's, whether it's something physical like the Grand Canyon, just like something just being so amazing and beautiful, or something like to do with time, like how old the universe is, just like a vastness. Alterations in time. Some people talk about it slowing down, or that the moment just being present feels so powerful. Or some people reference that like time didn't exist. Connectedness, you touched upon that.
Yeah.
That's a big one. People reference just feeling connected to all things, people, love, nature, and the need for accommodation. That they just don't even have the words to describe this kind of mystical experience. There could also be physical sensations that happen in the chair, whether it's goosebumps, chills. People talk about maybe their fingers or their toes felt numb. They could feel like they're floating. Again, just that very relaxing sensation of a massage. And then, as we also touched upon, it's not necessarily all good. Challenging material can come up, but your subconscious will not show you anything you're not ready to see.
I had one patient that kind of likened it to like a magician act where, you kind of cut the body in half, which sounds very negative, but that's what the patient was feeling in that minute. but was able to utilize tools. This is okay, right? It is a dissociative medication. And then the lesson came out, right? And able to run with that. And those are things that we need, those tools in that moment, if it goes that direction, to be able to handle.
So the adaptive aspect of the way the medicine works is the talk therapy sessions, integrating what the ketamine journeys, what happened and how that applies, what kind of insights or what kind of things, may have come up that you thought you had worked through or weren't necessary, but ends up being something that you still need to explore and go a little deeper. Self-limiting beliefs is a big piece that has been identified with clients having successful healing journeys. Just thoughts that were on loop that they didn't even realize were on loop, that were kind of repressed, buried deep in the subconscious, that have come out through the journeys.
Yeah, that inner doubter, I don't think we talk enough about. And even I think it oftentimes is a block to a healing path. Either whether I don't deserve to be healthy or there's too many obstacles in the way, and to have a tool again that can move that to the side or help to remove that barrier, I think is very powerful.
Yeah, I had one client who saw her mother who had passed in a journey, and they had a challenging relationship, but they had made amends before she had passed, and there was love and forgiveness expressed. So she didn't think that this was still something that she needed to work through. But her mother did appear in the journey and she gave her a big hug. She embraced her. But not only did she embrace her with this warm hug, she saw like the lineage of her ancestors, like going beyond her mother and like kind of vibrating in this hug. So as you can imagine, it was just so powerful on this more visceral like level of feeling that she ended up sharing a lot more about her mother, things that she didn't know that she still needed to kind of work through.
Yeah, I've seen the studies on the oxytocin released with a single hug. Imagine, generations behind that,
Yes.
even more powerful.
Oh, and then just back one. The other thing now, just observe, don't absorb. A colleague told me that quote a couple months ago, and I've used it so often. I just think it's really wise, and I think ketamine allows you this opportunity to not be overwhelmed by the challenging material, but to be able to look at it, talk about it, and not take it in where it's too difficult.
Yeah, for me, in many ways, that's like the flip side of letting go too. It's like I feel like a lot of times, especially an emotional response for many of us comes up and we just get attached and run with it without allowing that little bit of space to, okay, wait a second. All right, I see it as an emotion, and then it kind of fizzles out as opposed to it building so big.
Right.
And I love that idea, both within the session and even outside of that.
So the neuroplastic window, the positive changes in self-awareness are easier to shift into during this time. So I like to tell clients to pay attention to their dreams. I think of dreams as another doorway into the same room that ketamine is entering. So journaling those dreams and journaling in general, meditation, paying more attention to your diet, being more nutritious, making healthier choices, exercising for sure. I'm a big believer in yoga, and time in nature I think is key too.
This is probably of the entire talk my favorite slide, right? And it is that window where in all my experience I see this kind of opening to these lifestyle changes that we all know, right? But then actually there's some energy behind it, right, to start working on that. And I ponder, is that the connection to something greater than ourselves, that removal of self-doubt, like so many, the neuroplasticity, is it all of these things coming together that open the doorway for what is better self-care. And that's, again, a remarkable potential side effect. Good. And here's the doctor slides. You can tell, one, it doesn't have a lot of pictures, and two, it's just a lot of writing. And again, it's just, in all my lectures, every tool we have, right? A hammer can be used to build a house, or it could be used as an instrument of harm, right? And so we need to know how to use tools well. We need to be aware of both pros and cons. We need to be well educated on how to use that tool. That being said, I do believe both psychedelics and ketamine, relatively speaking, are very safe procedures, especially when administered in the setting, as we're discussing, in a medical setting with oversight, with preparation, with integration afterwards. These potential side effects do include that heart rate and the blood pressure going up. If somebody already has an extremely high blood pressure or issues with their heart, something to be aware of. Again, a lot of things that Stacey already discussed, but these different sensations, physical numbness, metallic taste, strange smell, blurry vision, even other things that I mentioned, we need to be aware of that these things can occur and how to, work with those. And then these potential side effects of dizziness, headache, dry mouth, poor coordination or decreased energy. A lot of this, I just want patients to be aware of, and again, not to plant a negative seed. And I do think a lot of it comes back to, Paracelsus said ages ago, the dose makes the poison, right? So a lot of these will be dependent on what dose is being used. Again, even more reason to work with a knowledgeable physician, practitioner, to make sure that you're getting right dose, to make sure that you're getting right support, that we would minimize these side effects. And again, a little blurry, apologize for that, but just the list, right? If you have anything on this list, you should be extra cautious, right? These are relative contraindications. So these could be reasons why you would not participate. I won't go through that entire list, but again, this is part of that process of any health journey, is making sure that this tool is right for me. And it just, every discussion, every lecture I give, I want to make sure that both sides are seen. Including a potential for harm, right? And this is something I read in my medical journals quite a bit. Ketamine poisonings are on an absolute rise. So they've increased 81%. And this is really thought to be not, again, under the medical supervision. We're seeing a lot of recreational use of ketamine. And that is, again, something that we're not talking about here. I am not against cognitive freedom, but these, we're talking about a therapeutic modality to be used for specific condition and symptoms, really should be utilized from a source. We know exactly where that medication came from, and it's a reputable, reliable, and precise dosing. We're doing that in a setting that is supportive and ruled out any potential contraindications or relative contraindications. And so we can optimize that chance for that positive outcome, which we're all looking for, everyone. And the therapeutic margin arguably can be narrow, right? And I know this could be an argument, but it is usually a very low starting dose, especially with an intravenous infusion. Again, most patients don't want to know too much about dose, but just to have an idea of where to start. And again, those best practices would be within a medical team, right? Supported by a medical team. There is medical oversight and properly spaced dosing. Ketamine is not, as you kind of hinted at as well too, and even in the protocol you shared, it's not something to be done on a daily basis. To allow the body breaks from this, I think, can reset receptors to make it a more effective treatment in the long term. I have had patients as long as 10 years on ketamine therapy, ideally giving breaks between sessions, but those pauses I think are absolutely important. And then I'll switch gears a little bit, as it was kind of an overall psychedelic talk. I think we all, as physicians, are getting more questions about this. It is a difficult area in that, again, ketamine, as well as all other psychedelics, which there aren't FDA-approved versions of other psychedelics at this point, are still illegal. So, while safety profile seems pretty promising, right? While there are some remarkable things about these substances, as a physician, right, there's still things that we can't really talk about, which makes it very difficult. I put this slide up here because it is research that I participated in, that one of the things we also don't talk about from this research, it was estimated that as many as 30 million individuals are already participating in psychedelic retreat centers and in other modes, that the horse has left the barn in many ways, right? And I put this on here, Oregon, Colorado already, decriminalizing and even legalizing supervised use. We need to really get smarter about this. And this was basically just a study, querying those individuals participating. Would you be interested in more research? Also going into reasons why they were participating, that we can learn more about this. There will be absolutely an FDA path, which I'm talking about as well. But we also have to have an eye on retreat centers, on this gray area where people are participating, make sure that we're making smart decisions. And I think just being the paternalistic parent and saying, no, 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 doesn't work. Let's have open conversations about that and learn more about it. This is super exciting for me. Very busy slide, and I apologize, but it's busy for a reason. These are all of the potential psychedelic drugs in development right now. Each one of these on the screen are potential therapies in the future. An FDA path can be estimated 5-10 years, right? So it takes a while for a lot of these to happen. A number of them, specifically psilocybin, MDMA, are in phase 3 trials, which means we're pretty close to these potentially being offered as an FDA therapeutic. Also on this list include LSD, DMT, ibogaine, mescaline, ketamine, and others. But there is a lot of medications coming down this path that are very exciting. And this is another project that I'm involved with some fantastic colleagues that are starting to pair, right? And it is exciting. AI, which is the buzzword right now, and now virtual reality. Could that be used to potentially make the therapy safer, to offer the therapy to more people, and to offer yet one more tool to support that? And this is kind of just a fun slide I threw on there as things that are happening in this space. And then this is I'm just really privileged to be a part of this team that I'm just have long been fascinated by plants, as many of my patients are aware too. And this is a company, Jaguar, that has an esteemed group looking at a library with ethnomedical investigations. So it has a background of ethnobotanical data of 2,300 plants. So even while that list is so long of potential medicines, there is a treasure trove existing out there that we don't know what might be the next therapy. And a little bit on my soapbox that this was a recent in 2020 article in the New York Times, is that, that treasure trove is kind of on fire, where, only 1 to 2% of our flora, right, the plants in the world, have actually been screened. And I just really believe that we're missing opportunities here if we're not protecting some of these to even be studied in the future. As psychedelics have been sitting under our nose for decades, for centuries, and really turned our back to it, and we're finally coming around to that. So we'll pause there. Maybe before we go to questions, just because I'm going to stop the screen here, we did put together a few resources. We always love to, kind of facilitate more knowledge. A few local clinics that do offer ketamine therapy. Again, looking for those with board-certified psychiatrists, board-certified physicians on board, looking for those with a well-established protocol, looking for those that cross all their T's and dot all their I's, and have good experience, right, in treating patients. Would you add anything to that, Stacy?
I think it's important to do your research and to talk to different providers before just jumping in, and make sure you're comfortable.
Good. And do you want to speak a little bit to the gracious offering that you're giving?
I'm happy to talk with anyone. I'm offering a free consultation for 20 minutes to hear about your circumstances, your goals, if ketamine is right for you, depending on where you live, the city, Westchester, New Jersey, Connecticut. I have different doctors and places that you could receive these treatments, infusions, or Spravato, the nasal spray. That one is the Johnson & Johnson medicine that is actually FDA approved for depression. So, and that one is usually covered by insurance. So that's also a key part of if that one makes sense for you. But yeah, you're welcome to be in touch with me directly if you'd like to explore any of it further.
Good. And then we'll just, we'll check if we have any questions. I'm going to stop sharing my screen here. If you have any questions, go ahead and post them here. We're happy to try to answer them to the best of our ability.
Looks like there's a chat.
Bear with us here as I'm bringing up chat. Oh, that's too bad. Looks like we didn't share our slides throughout the entire thing.
Wow.
Apologize for that, everyone. We will make the slides available, certainly.
Yes.
Any other questions? Good. Well, I appreciate everyone showing up. We'll figure out some way to add the slides to the presentation that we put on YouTube, and we'll make those available. If you'd like to, you feel free to ask us for those. Thanks for attending our SeeBeyond seminar number 4. We're trying to get a little bit better, a little hiccup this time, but I really want to thank Stacy for your time and your expertise and sharing all that with us. And I hope you guys have a wonderful weekend for 4th of July coming up, and thanks for attending.
Thank you.